There are more microbial cells inside our body than human cells. So we're not just human, we're not just a person, we're a whole ecosystem. You know how they say the gut is pretty much the second brain because my dad taught me that. But in diabetes, there are ecosystem changes in their gut. So today we're going to talk about the microbiome, diabetes, chronic inflammation, gut dysfunction, how that affects our diabetic ulcers, immune collapse, and wound healing failure. And that's why the future of limb salvage might also include healing the gut as much as healing the wound. So, what is the microbiome? The microbiome refers to the trillions of microorganisms that live in our intestines, on our skin, in the mouth, in the wounds, and throughout the entire body. And these organisms include bacteria, actual fungi, viruses, and archaea. And the gut microbiome is pretty much the largest and most influential. So think of the gut biome, microbiome, as an internal rainforest. A healthy rainforest has balance, biodiversity, cooperation, defense systems. It's like a perfect little world. But a damaged rainforest, it loses diversity, stability, and protection. And the same thing happens in diabetes. So, what does our microbiome actually do? Many people think bacteria only causes infection, but healthy bacteria is actually essential for our life. So, our microbiome helps regulate inflammation, trains your immune system, digest food, help produce vitamins, protects our intestinal barriers, regulate our metabolism, communicate with the brain, and influence insulin sensitivity. So without a healthy microbiome, inflammation rises, immunity becomes dysfunctional, metabolism worsens, and the wound healing slows down. You see what happens? Like that sounds a lot like diabetes. So how does diabetes damages the microbiome? So, diabetes creates this hostile environment inside our gut. The high blood sugar changes the nutrient availability to the bacteria, it changes the intestinal pH, it changes the oxygen gradients, it changes the immune signaling, and it changes the gut permeability. And over time, these changes, which the bacteria survive on, creates this imbalance called dysbiosis. Okay, and what does dysbiosis mean? Dysbiosis means an unhealthy microbial imbalance. So what happens during dysbiosis? So in healthy gut, there's beneficial bacteria that dominates, inflammation is controlled, and the gut lining stays strong. But in diabetic dysbiosis, the harmful bacteria increases, the beneficial bacteria decreases, the inflammation rises, the intestinal integrity weakens, and this creates a chronic systemic inflammation. So, what are the beneficial bacteria that actually decrease? So, research shows many diabetics have lower levels of lactobacillus, bifidobacterium, and bute. I'm just going to try it. Butyrate, butyrate, butyrate. Okay, there we go. Producing bacteria, and I'm just going to spell it Butyrate. Butyrate. Okay, that's what I'm going to call it. And these bacteria normally calms down the intestines and the inflammation. It nourishes the intestinal cells. It strengthens the gut barrier and improves the metabolism. But one major molecule they produce, which is butyrate, that's what we're going to call it. That's what I'm going to call it. Butyrate is a short chain fatty acid. So it acts like fuel to the colon cells, and an anti-inflammatory signal and a gut barrier protector. So when butyrate levels fall, inflammation rises, the intestinal cells weaken, and permeability increases. And leaky gut, right? So the intestines are lined with these tightly connected cells, okay? And these tight junctions act like security gates. But in diabetes, the inflammation changes these junctions and there's increase in the permeability between the cells. And this causes something called increased intestinal permeability. And informally, they call it leaky gut. And this means the inflammatory molecules can enter into the bloodstream more easily. So there's a certain bacteria that contains a molecule called lipopolysaccharides. I think that's very common for us to know that terminology, lipopolysaccharides. So lipopolysaccharides, they LPS, they are inflammatory toxins that are found in gram-negative bacteria. And when the gut barrier weakens, the lipopolysaccharides leak into the circulation, the immune cells activate, and this causes a chronic inflammation. It actually increases. And this is called metabolic endotoxemia. So you can explain this by saying, we can just say the gut wall becomes a broken border and the inflammatory invaders cross the bloodstream, just like the White Walkers. Okay. Anytime I'm going to make a Game of Thrones analogy, Gabby will. So the cytokine storms of chronic diabetes. So once the inflammation activates, the body releases a signal molecule called cytokines. We already know our important cytokines, TNF alpha, IL-1, IL-6, okay? And what do these molecules do? They increase inflammation, they impair insulin signaling, they damage the blood vessels, and they impair healing. And this creates a vicious cycle. The high glucose causes dysbiosis, the dysbiosis causes inflammation, and the inflammation causes a worsening of the glucose control, and that causes more dysbiosis. So, how does this affect our diabetic ulcers? So, our impaired immune function, right? The microbiome helps train the immune system, okay? So when dysbiosis occurs, neutrophils function poorly, macrophages become dysfunctional, inflammatory balance fails, and this means our immunes stay inflamed longer. Bacteria fights poorly and becomes chronic, right? And chronic inflammation, remember, normal wound healing phases are hemostasis, inflammation, proliferation, and remodeling. But in the diabetic wound, they get stuck in the inflammatory phase. And this isn't just regular inflammation, this is dysfunctional inflammation. So, this dysfunctional inflammation destroys the cells, damages growth factors, delays granulation, and impairs the collagen formation. And the microbiome may contribute heavily to this inflammatory lock-in syndrome. So also, another thing that it affects is impairs your angiogenesis. We already said angiogenesis, that's what we want, that's what we love. We want that formation of new blood vessels. Healthy angiogenesis would help healthy healing, right? Because we require oxygen delivery, nutrient, and capillary growth. But the chronic inflammation interferes with the VEGF signaling, the endothelial function, the nitric oxide production, and without these new blood vessels, which we definitely need with our diabetic wound healing, the tissue dies, the ischemia worsens, and the wounds do stall because of the dysfunctional inflammation. So, another thing that it affects is the collagen. Collagen is the structural scaffolding of healing tissue. So, the inflammation and the oxidative stress impairs the fibroblast, reduces collagen synthesis, and weakens the extracellular matrix formation. And what would that mean? That would mean we would have fragile collagen reopening easily of the wound. So, that's why there's a lot of recurrence, right? And it could heal slowly. Another thing that it affects is the biofilms. We already know how impermeable and how resilient biofilms are. Bacteria biofilms are their communities. It's like the slime like matrix, okay? And they act like a microbial fortress for these bacteria. The biofilms help with resistance to antibiotics. It helps it evade the immune attack and it helps chronic inflammation persist. And diabetic wounds are especially vulnerable to biofilm because their immune system was already impaired, their circulation is already poor, and the inflammation is already chronic. So let's talk a little bit also about the gut skin axis. And yes, there is one. So the gut and skin communicate through immune signaling, inflammatory mediators, and microbial metabolites. The gut dysfunction worsens the skin barrier health. It worsens the inflammation and it worsens the wound susceptibility. And this relationship, the gut skin axis. Now, there's another axis, the gut immune axis. the gut actually plays extremely high role when it comes to our immune system. So the gut microbiome constantly communicates with our immune cells, okay? So the gut is actually the home of a massive portion of our immune system. So when we have dysbiosis, this would overactivate our immunity, suppress our proactive responses, increase our autoimmune signaling, and impair the infection defense system. And another thing, we also have a gut wound axis, okay? So there may be a direct gut wound healing relationship. I believe there is. I believe there is. I'm sure there is. Meaning that the gut influences the inflammation. We already just discussed that. The inflammation influences the healing. The healing influences our limb salvage. So, modern research has been exploring this field. Studies suggest that diabetics often have lower microbial diversity. Obesity actually changes the microbial composition. Inflammation alters gut ecology. Some bacteria influence insulin resistant. Gut metabolites actually affect the vascular health. Researchers are now studying probiotic therapies, microbiome based medicine, fecal microbiota transplantation. That's when they put the poop inside your gut, right? And precision microbiome treatment. And I think I saw something online when this girl tried to do it at home and got extremely sick. So I think it is common sense not to do this at home. Okay. So if you see something online and somebody's like trying to do a fecal transplantation on own at home, please don't do that. Okay. It's either way, you're going to get to the hospital. Okay. So don't do it. Don't do it. Just don't do it. Okay. Okay. Now, probiotics. We all need probiotics. Probiotics are the live beneficial microorganisms like lactobacillus, bid, bid, bis, oh my gosh, bifidobacterium. So these beneficial bacterium benefits us by improving our gut barrier function, reduces inflammation, improves insulin sensitivity, improve immune regulation. So not all probiotics are equal, but different strains do different things. There's also prebiotics, okay? Prebiotics are food for beneficial bacteria like fiber. Fiber are prebiotics. There's resistant starches and inulin, not insulin, inulin, okay? And these help the beneficial bacteria produce the butyrate and anti-inflammatory compounds. Now, symbiotics. Symbiotics combine probiotics plus prebiotics. So this is their attempt to induce healthy bacteria as well as feed them simultaneously. And then our postbiotics. Postbiotics are beneficial compounds that are produced by bacteria. And these examples are like the short chain fatty acids and the microbial metabolites. And this is emerging in research today. So, what are some signs of dysfunctional microbiome? Potential warning signs are bloating, constipation, diarrhea, recurrent yeast infections, poor glucose control, chronic fatigue, foul wound odor, recurrent infections, and food intolerances. These are non-specific symptoms, but not definitive proof of dysbiosis. So just keep that. So how do doctors test your microbiome? Current methods of testing your microbiome is stool microbiome analysis, GI mapping, stool cultures, inflammatory markers, and nutritional labs. Okay, so many microbiome tests are still evolving and they're not universally standardized as yet. So who should we refer our patient to, or as a patient, you should go to when it comes to this? Depending on the symptoms, you might get referred to gastroenterology, endocrinology, might be going to infectious disease dietitians, a nutritionist, or wound care specialist. That's why we always say the multidisciplinary team. One cannot just do it all. So how do we improve our microbiome? By nutrition. We increase our vegetable intake, fiber intake, fermented food, and reduce the ultra processed foods, which is in abundance everywhere, right? And it's cheaper too, right? And you reduce your excessive sugar. Another way you can help with that, glycemic control. I think everybody knows that's the easiest way to try to help with your diabetes is glycemic control, stabilize your glucose, supports a healthier microbiome balance as well. Exercise. We already know exercise help make these what are collateral branches when it comes to microvascular disease or any circulatory health, right? They'll put you on an exercise program. And exercise increases microbial diversity as well as your metabolic health. Sleeping. Poor sleep disrupts your circadian rhythm, your metabolism, and your microbiome stability. Now, stress reduction. I believe in my theory, I believe that having a diabetic also is quite stressful. It's a lot. It's it's mentally stressful like with the follow-ups and everything, getting the right materials, the resources that you need, all the follow-ups is stressful, okay? And we have to find a way to make sure to make this process not in a doomsday process, but in a process that is still a very cooperative, calm process for the patient that they don't have an increased level, right, of stress. But stress affects your cortisol, your gut mobility. That's why, like, sometimes if somebody gets stressed, they get like have to go to the bathroom right away, or somebody's stressed, they vomit. That stress is actually a big deal. It affects your inflammation and your microbiome composition. Now, another big thing is a lot of diabetics when they have diabetic foot ulcers, especially if they have affected one, they get what? Antibiotics, right? So, antibiotic stewardship. Repeated antibiotics may kill beneficial bacteria, may worsen the dysbiosis, may encourage resistant organisms, okay? Although antibiotics are one of the greatest inventions in medical history, they save limbs, they save lives, but every antibiotic is also an ecological event inside that person's human body. So, what do the antibiotics actually do? They kill a bacteria. Most people think antibiotics kill bad bacteria, but often antibiotics also kill the harmful bacteria as well as the beneficial bacteria, especially broad spectrum antibiotics. So this creates something called collateral microbial damage. So the gut is an ecosystem and antibiotics are like a wildfire through the rainforest. So some harmful organisms die, but also some protective bacteria do as well. So what happens inside your gut after antibiotics? The microbial die off. So antibiotics reduce the bacterial population. This includes the beneficial flora. This includes the butyrate producing organisms. This includes the inflammatory species. The microbial diversity drops. And this is important because diversity equals resilience. A healthy microbiome needs many species to work well together. Also, what does the antibiotics do? There is loss of colonization resistance. So healthy bacteria normally protects the gut by competing for the nutrients, occupying the space, producing antimicrobial compounds. This is called colonization resistance. But when beneficial bacteria die, harmful organisms gain space, opportunistic organisms expand, and this creates a microbial imbalance. Now, another thing that happens with antibiotics, there's opportunistic overgrowth. So after antibiotics, certain organisms may overgrow. Examples would be candida, like fungus, right? Clostridium difficile, C. diff is very common. Resistant gram-negative organisms. So normal, checks and balances disappear. And this is why some may say the microbial police force has been wiped out. And Clostridial difficile, C. diff, is very important because it's an infection that becomes deadly after antibiotic use. Why? Because normal healthy bacteria suppresses C. diff, right? But some antibiotics, we'll talk about that one, if C. diff expands, toxins can be released and severe colitis. Now, I just want you to just keep in mind there are certain antibiotics that are high risk for patients to getting C. diff, and those are fluoroquinolones like Cipro, levofloxacin, clindamycin, cephalosporins, and some penicillins, okay? And how do we treat C. diff? Usually, they put you on metronidazole flagyl. But what are the symptoms of C. diff? Is going to be severe diarrhea, abdominal pain, fever, dehydration. That's usually why your doctor keeps on asking you after you are taking your antibiotics, any signs of diarrhea, fever, dehydration. And in just rare cases, it can cause sepsis, toxic megacolon, which is a big deal, and death. Okay. So always be honest with your doctor when you're starting having symptoms. Another thing, let me just elaborate on the candida overgrowth, the fungal organisms, because a lot of women know that if they go on antibiotics, they'll get a possible yeast infection, right? So the fungal competition decreases and the candida can expand. So some people might end up getting oral thrush. There are some vaginal yeast infections, fungal infections, intertriginous infections, right? And in diabetics, high glucose makes fungus grow faster and easier. Now, also the loss of our short chain fatty acids. So the beneficial bacteria that produces butyrate, acetate, propionate, these are short chain fatty acids and they help reduce inflammation, strengthen the gut barrier, and regulate immunity. And antibiotics may reduce the short chain fatty acids, and the consequence will be increased inflammation, weaker gut lining, immune dysregulation, and damages to the gut barrier. So, without a healthy bacteria, intestinal cells lose support. Mucus production decreases, permeability increases, and this weakens the intestinal wall, and the result will be inflammation. Molecules leak into the circulatory system, and systemic inflammation rises. And then the immune dysfunction, dysregulation. So antibiotics actually alter T cell regulation, macrophage signaling, and inflammation balance. And this contributes to the prolonged inflammation, impaired healing, and altered infection defense. And how does this affect our diabetic ulcer? Like I said, repeated antibiotics worsens the dysbiosis, impairs the immune balance, increases fungal and colonization, alters wound microbiology, and encourage resistant organisms. Meanwhile, the diabetic ulcer is already struggling with ischemia, biofilm, inflammation, and impaired immunity. So the body is trapped in this inflammatory infectious cycle. And then we have to also think of antibiotic resistance. So overuse and repeated exposure may make some patients susceptible to MRSA, VRE, and resistant gram-negative bacteria. And these organisms are quite harder to treat. Usually, might most likely require admission sometimes, chronic wound, recurrent hospitalization, and osteomyelitis. And what does the research suggest when antibiotics? They rapidly reduce the microbial diversity, alter the microbiome composition for months. It changes the patient's metabolism as well as affect the immunity. So some certain microbiome changes persist long term, especially after repeated courses, prolonged therapy, and multiple broad spectrum regimens. So, can the microbiome recover? Yes, but the recovery varies. Some bacteria recovers within days, some bacteria recovers within weeks. Other species takes months, other species takes years. Some may never return. So, recovery depends on the patient age, the patient's diet, the diabetes severity, the duration of the antibiotics, and existing microbiome health. So, like we said, antibiotic stewardship is quite critical. Okay. Not every wound needs prolonged antibiotics, broad spectrum therapy. Sometimes it's good to have infectious disease on their board, especially because I know we all like, oh, I know how to do this, right? But if I'm going to get infectious disease, ask them what they think. What's the right probiotic that the patient should take? They know all that jazz, right? Fiber. Taking fiber is quite beneficial. Like we said, make sure to take your vegetables, legumbres, oats, fruits, resistant starches. Now, they said fermented foods. I'm not talking about alcohol, okay? Or rum cake. I'm talking about yogurt, okay? And they said kimchi is actually one that helps support microbial diversity. So we shall see. And probiotics. They're over the counter, right? But I would talk to my internal medicine doctor or my nutritionist, you know, because they said some organisms like lactobacillus, bifidobacterium, they can help reduce antibiotic associated diarrhea, reduce C. diff risk in some populations, but not all probiotics are affected, okay? The strain matters, and they are very cautious in using it in immunocompromised patients. That's why you need to talk to your internal medicine doctor and your nutritionist before anything, okay? And glycemic control. So, in the end, like we know, antibiotics can save the village while simultaneously burning the forest, okay? So the microbiome is an orchestra. The antibiotics may remove a whole entire section of instruments, and then suddenly the immune system begins playing out of tune. So antibiotics may save a diabetic foot, but healing does not end when the prescription route. No, the prescription course ends. I'm like, route? But because this alters the infection, although the infection could be gone, the body must still rebuild an entire invisible ecosystem yet again, okay? So we have to remember that the diabetic foot ulcer is not just a wound. It may be a visible scar of an invisible system dysfunction. I always said when the diabetic foot ulcer is there, it's like the white flag, I say wagging, the white flag in the air saying, "I surrender now," okay? Like, the diabetes is taking over. So, I would always take it very seriously and make sure to treat the patient as a whole, not just the diabetic, but also make sure everybody that is supposed to be on your team is on your team and seeing that patient, okay? And this is Diabetic Foot Files, and I'm Dr. G. Happy Sunday. I wanted to call this System Sunday. I know I'm gonna get tired of the alliteration soon, but yeah, this is Diabetic Foot Files. Take care of your feet because they take care of you.